Welcome everyone. It is my pleasure to have you here for an amazing opportunity for learning about care reform in East Africa. My name is Delia Pope and I have the absolute honor to be a trustee for Railway Children, the organization hosting and putting a significant amount of effort to bringing a number of excellent speakers from across the region to talk about care reform, to talk about children, well-being, child protection, and all sorts of other very important issues. I will start with a little bit of housekeeping on the technical side. On the left-hand side of your screen, you have your buttons that control your microphone and your video. If your connection is not too great, please feel free to turn off your video. It might improve the audio connection. Please keep your microphones on mute and feel free to use the Q&A button to put in your questions and your comments throughout the presentation. We will make sure that we collect all these questions and will direct them to the speaker. So if you have questions specifically to a certain speaker, please make sure you mention the name. If you have general questions, leave them with us and we'll try to make sure that we have the best brains trying to find the right response for you. There is also translation available. You need to pick the channel that will enable you to find the right language. You can see at the bottom of your screen, you have the number of participants and you have the chat box. Everyone, please get familiar with the settings. Make sure you keep your microphone off because the noise will prevent a good sound for other participants. And please be engaged, talk to us via the chat. And I wish all of us a wonderful 2 hours. We are here to talk about care reform in Eastern Africa, to look at global perspectives, emerging lessons, challenges, and critical issues in providing care for children without parental care. We have an amazing group of speakers who together bring an extraordinary amount of knowledge around child protection and care issues, and I will introduce them one by one. I have some experience in the field of care reform. I have the pleasure to have encountered most of the speakers in this session and work with some of them, which is quite extraordinary. And once more, I'm here to represent Railway Children, a fantastic organization working with a group of children who are usually left behind in many cases when care reform comes about. So before we delve into these amazing presentations, I would like just to recap what are the fundamentals before we dive into learning and into our lessons. One, we know that the best place for children to grow up is in a caring and nurturing family. We want that to provide a stable and supportive and safe environment for children, adults, parents, and caregivers need a set of core life skills. We know that adversity disrupts children's development. Extreme ongoing stress can have serious damaging effects across the lifespan, resulting in significant costs for communities and nations. We know that the most common factor for children who demonstrate resilience is at least one stable, committed relationship with a supportive parent or caregiver. Positive early experiences, support from responsive adults, early development, adaptive skills, all can counterbalance the consequences of adversity. We also know that poverty leaves many families without the resources that they need to provide what their children need: health, education, access to specialist care. We know that disability, we know that discrimination, social isolation, gender-based violence lead too often to the unnecessary separation of children from their parents. We know, and we have strong evidence, that institutional care does not adequately provide the level of positive individual support and attention from consistent caregivers and has a negative impact on the development of children. We know that the United Nations Conventions on the Rights of the Child recognizes the central importance of family for children. We know that the UN guidelines for alternative care of children set out an objective for the gradual elimination of institutional care for children. We know that globally, we are making progress. Deinstitutionalization is actively utilized as a key driver of change at the level of the child protection system. And we know that the success of the process rests in the participation and inclusion of children in the decisions that affect their own lives, such as decisions about their entry into care, their transition within or out of care, which should always be done in consultation with children and bring them on board according to their evolving capacities. It is my absolute pleasure to invite our first speaker, Frederick Mutinda, a great advocate for children in families and the director of Change the Way We Care for Children Kenya. Frederick has over 16 years experience in supporting children across a range of issues and sectors, with a fantastic track record of collaborative work across faith communities, government, grassroots communities, and NGOs. Frederick will share with us the lessons learned in Kenya by Change the Way We Care. And you have only 15 minutes. I'll give you a 2 minutes warning and an okay sign when you're done. Take it forward, Frederick. Thank you.
Thank you so much, Delia, and good evening, everyone, and also good morning, depending where you are picking this call from. So I'm also really excited to be here to share with all of you the journey of care reform in Kenya. As you know, Kenya has an history of residential care services for children. And within this, the first slide here, I think I really want to start by sharing where we started as a country. And the most important thing as a country was not even to develop any policies, any guidelines, but to have a common understanding, what do we mean by care reform? Because what we realized that when we were starting back in 3 years, some people were doing foster care and they were calling it care reform. Others were doing reintegration of children and they were calling it care reform. Then there was the big and very long terminology of deinstitutionalization of children. Again, that was a very scary term even to some of the stakeholders and especially the managers of CCIs. So what we agreed as a country, it was both state and non-state actors. Can we agree what care reform means for us? And we agreed that care reform had 3 very critical elements. And here in Kenya, we refer it as care reform Mercedes, whereby we talk about prevention and family preservation and transformation of institutional care and the whole subject of alternative care. That was very critical because what it did is that all of us, we were able to know care reform is not only one element, but rather it's a complex issue. And again, when that was clear, then we were clear on then who is involved in care reform. It was very clear that there was a need to involve children and youth, families and caregivers, service providers in the community, because many of these children are leaving their families because of services that are lacking in the communities, and institutional care is offering those services. Then the whole agenda about the systems change was also very critical. And a good example is that children in Kenya, they end up into some of these residential care facilities because of a systems order. The judicial systems gives a committal order, and then a child is placed. And until the system is favorable to care reform, then that wasn't going to happen. And then, of course, the whole idea of the resources involved in care reform, that was also very critical to be an agenda during our foundational discussions. Because again, the issue is not to stop the resources, but to ensure that we are bringing more resources, but directing them towards family and community-based support. So with this, just to speak a little bit about the famous Mercedes, or our three-pronged approach, you'll find that why was this critical for us to be able to have a common understanding on what needs to happen in each of the three elements. Speaking about transformation of institutional care, we know that when the discussions about care reform started in Kenya, then the managers and the proprietors of these institutions were afraid. And some of them thought maybe they were being thrown out of business. Others were asking what next. The children in these institutions, they were afraid, where will we go? The parents who had institution in these institutions, parents who had children in these institutions were also afraid. But we had to engage them and to inform them it is not about closure. It's about a gradual phase out of institutions. And of course, each and every institution will also think of their transition plan depending on the nature of children and families that they serve. But of course, at that level, we also needed to have enough policy, legislation, standards, guidelines that will guide that process. And I think this is really bearing a lot of fruits, because as we speak now with the government, since now the National Care Reform Strategy has been approved by the Cabinet Secretary, who is like a minister here in Kenya, we are now on that stage of developing a national level transitional guidance. Of course, matters of prevention and family preservation are very critical, because the only solution to have children have permanent caregiver is by having resilient families. So with government and other stakeholders working through the national family promotion policy that is almost being finalized, and the national parenting program, that has been critical, also supported by other social protection services that are geared towards strengthening families, and at different government programs and at different other stakeholders. And of course, if we were to substitute these children who can't go back to their biological families with a family or community-based care support, then having a strong alternative care framework was really critical. And in Kenya, we realized that there was a gap, because what was commonly used was the adoption. And as you know, we have an inter-country adoption moratorium, and also foster care, which also was not really well defined. And many of these children were also going to kinship care arrangement. And again, as you know, because we didn't have any guidance, then that wasn't much defined. But as I speak through the other slides, then I'll be able to share what we have been able to do in those areas. Then speaking of these three elements, and speaking about complexity of care reform, which we needed to understand, and in Kenya we have understood that we have different major components that are very critical for us to be successful when it comes to a systemic change in care reform. And the first one, not by any order, I'll start with laws and policies. What happened is that when the care reform efforts was started by the government, UNICEF, Changing Baby Care, the Life of Hope and Homes, and other key stakeholders, then we needed to ask ourselves, how are we doing in terms of laws and policies? Did we have laws and policies that were supporting these paradigm shifts? Because for many years, Kenya has relied on institutional care as a way of taking care of children who can't be with their biological families. And that's why the figure 45,000, which was quoted back in 2014, you have seen it, but we do believe the children might be much more than that. And one of the things that we have done is that we had an opportunity to review the Children Act 2002, whereby now we have a Children Bill 2021 that is in Parliament, and we got a very good opportunity as care reform actors to really ensure that the care reform effort that we are proposing, they are anchored in that legislation, including very clear regulations on different forms of alternative family care and management of this institution. Of course, coordination was really critical. And when we started through the National Council for Children's Services, which is a government, semi-autonomous government agency body, we formed what we refer as the National Care Reform Core Team. This core team, which is composed of both state and non-state actors, has been able to guide the government and to guide the country and to draw a roadmap on how Kenya will systematically transform its care. Of course, families, communities, and alternative family care services, as I said, they are very critical. So how do we ensure that we have services, programs that promote inclusive family strengthening, and not only thinking about children who are already in the institution, but also children who are at risk of separation, so that also we are closing that gap. Social norms and behaviors, as again, you know, there is the practice, there is the attitude. This has been critical, thinking through with the government about coming up with the social behavior change strategy. That has been one of our primary goals here in Kenya, just to ensure that people are seeing the problem, they are changing their attitude, and then they'll change their behavior. Up to that point whereby we see even families demanding for their children from these institutions because they do believe that families are the best. And with this, we have seen managers of charitable children institutions who are really ganging up to object the whole idea of care reform. Some of them, like for example, in Kilifi, one of the managers was very vocal against care reform, has been the first institution in Kilifi to fully transition. So I think that's very critical. Data, evidence, and knowledge. Again, care reform, there is a lot of learning. A lot might have happened in Europe, but when it comes to Kenya, East Africa, it's a different context. So whatever lessons we learn is very important, but how do we ensure that also we have a system that even is capturing this data? And one of that system in Kenya is the Child Protection Information Management System, whereby 2 weeks ago, we worked on the module that is capturing care reform related information without that gap. Skilled workforce, very critical. Government of Kenya, together with UNICEF, together with other stakeholders, there is a program to train government staff and government officers on matters of child protection, but most of the components of care reform. But again, we do realize the government doesn't have all the resources to support each and every family. Then how we have also invested in training the social workers in those residential care facilities, the CCIs, what's commonly referred as orphanages in other countries, and also the parasocial level workforce. These are the child protection volunteers, the CHVs, the lay counselors who are at the lowest level of the community, and they do work directly with families. And of course, the whole matter of redirecting resources. We just completed a funding stream analysis just to understand how much is coming in Kenya to those institutions. Then we are using that to try and see if we are to direct resources, where do we redirect? So what was the ingredient to this success that we are seeing here in Kenya? I can tell you, just spending time to ensure that you get the right buy-in is very critical. We spend almost 6 months, 8 months trying to work together with government, just try to get the relevant buy-in from different departments, different sectors. That was critical. Understanding the problem through the situation analysis, again, which is also available for us. Setting up and work with government just to first develop a roadmap. If we were to do this, then how do we proceed? Then inclusive participation. Everyone needs to be on the table, including children, caregivers, lived experiences, and all different actors. All of us, we need to be on the table to discuss this, and that has really worked very well. As I come towards the end, and some of these I've talked about them, consideration about working with government, involvement of key decision makers very critical. And we have seen this because both the cabinet secretaries who have been there during this time, they have been very vocal and they have been involved in this and they have supported these efforts a lot. Policy, very critical. If we have policy directives, then it means no matter the change at that level, then there will be continuity. And of course, political will, because we're talking about legislation here. So just to show something on how do we take it to the field, we ensure that we have the right standards and guidance for case workers to understand proper case management for reintegration, then also unpacking the alternative family care, what it means, development of the standard operating procedures, so that even the people who are practicing that at that level could be able to implement that. And of course, as I finish our priorities for the next few years, it's approval of the National Care Reform Strategy, which has finally been endorsed, and then rolling out of the standard operating procedures that have been finalized, and advocating for increased resources because we have a serious budgetary gap when it comes to this. And of course, you can see the rest. So thank you so much for giving me this time. I hope I'll be able to interact more in case any question or any comment will come up. Thank you, and back to you, Julia.
Thank you so much, Frederick. What a wonderful presentation, fantastic bird's eye view in working at system level with a lot of very relevant lessons. I want to encourage the audience to put out questions inspired by this presentation. I know 15 minutes, it's not enough to go through all the detail. Thank you, Frederick, and I'm sure our listeners will come back to us with a lot of questions. Now, we are going from Kenya to Uganda. I would say via Rwanda, because I am going to invite to the microphone Karen Shakira, whom I worked with in a fabulous team of Hope and Homes for Children in Rwanda, and who is now supporting the monitoring, evaluation, and learning in the brilliant team of Charles Eye Foundation in Uganda. Karen is one of the pioneers of care reform and deinstitutionalization. And her experience across the two environments, I think, will be very interesting to delve into. Karen, you have 15 minutes.
Thank you so much, Delia. Good afternoon, good morning from wherever you're coming from. I'm glad to be part of this conference. I'll start with Child's Eye, what Child's Eye is. We are a non-governmental organization working with government. Hello.
We can hear you, Karen.
Hello.
We can hear you.
Okay, thank you. We are a non-governmental organization working. Oh, yes. Can you hear me? Yes. What is our mission? Our mission is to enable Uganda fully commit as a nation to curb the spread of orphanages, repurposing and reimagining the way we care for vulnerable children. Our vision is that one day, Uganda free from orphanages, all children will belong and grow up in loving families. So that's who we are. What is our experience with care reform in Uganda? From the last 3 or so years, we've implemented on deinstitutionalization work. We've come to realize that care reform is successful if government takes the lead role in it, and also continuously being led by the legal framework. Again, it's an area that requires key actors who are government, UN agencies, the academia to come in, and we have some bit of recording on research and having an evidence-based perspective concerning what care reform is. Residential care facilities are also our key actors. These are institutions that host these children. Existing national and international legal frameworks. In Uganda, we have the Children's Act. We have the legal framework that guides care reform in country, and this is all that we base on to have our implementation continue. As we started care reform work in Uganda, we realized that there is need for engagement at both national level, district level, and bring everyone on board in regarding to understanding the relevance of government and officials to achieve full support and ensure that implementation is government-led and in line with DI and its requirements and laws. This translated into MOUs being signed, working together with government to ensure that at least we are the forefront of DI, but again, we have clear systems in place in regard to what we are going to offer to the country and also what we shall offer as a learning to others. What does our case management and care reform at district level entail? We realize that in order to do this, we require successful drivers of care reform, and one of it being providing alternatives to existing model of care reform, and also looking at how we can be able to change and also divert and advocate on the way we care, considering the different support systems in the community, looking at different models that can support children wherever they are, especially vulnerable children, but mostly those at community level at risk of separating or already separated with their families, having in place gatekeeping structures. These are systems, system strengthening, looking at what structures we can be able to reinforce to ensure that we stop separation or prevent any separation of children, case management and monitoring, building the capacity of stakeholders. These are local authorities, their parents, their caregivers, implementing of the known existing policies and frameworks. I already talked about this, ensuring that we are within what government requirement is in regard to how care reform is implemented in country. Having an evidence-based reporting and sharing documentation and advocacy, this has continued to be evident in whatever work we are doing, and supporting both local and non-governmental organizations to ensure that at least we are moving together and we are indicating what challenges, what evidence we are sharing with them, and how best they can be able to come in to also support and ensure the entire process is moving on successful. We've done some work in on DI in Uganda, and I'm just going to share what processes did we go through in order to have our DI successful for the areas where we've been able to implement it. One, deinstitutionalization, I would first define it as a process of successfully reintegrating children from orphanages into family and community-based care. They may be children of all categories. Mainly, most of them are young children, and also we have in a number of young adults that have lived their life in the orphanages and go through a phase of preparation and acceptance for moving into communities and finding alternatives for them, especially for the young children. So we have the process that entails engagement. Here it involves engaging the parents, engaging the different stakeholders, the community volunteers, the local authorities, and also understanding what are the circumstances that have led to their separation. What attitudes and practices regarding the separation and use of institutional care. What could be the problems? Could it be because maybe there is an existence of an orphanage in a place and that's why parents find it very easy to place in these children? Another level is, another part of the process is the assessment, understanding what the community is like and ensuring that we've supported children in institutions, parents, extended families, and other professionals to ensure that we assess, we understand the different needs of the children, we understand the different needs of the parents, and how we can collaborate together to ensure that there is successful deinstitutionalization process. So the process is successfully done without harming anyone and without having everyone in consensus and understanding the reason of why it should be done the way it is done. We have in a bit of design and development that involves matching the needs of children and their families after understanding the circumstances that have led to their separation. This is usually at a decentralized level with a regional coordination team, who most of them would be social workers, and also developing new services for the children and also for the young people they are transitioning. In this regard, it would require a whole range of multidisciplinary teams to come together to understand what needs they are addressing for the children and also ensure that successful transition and designing of the services they may require is done. Next slide. We have in the second last step being transition. This requires a lot of work about preparation of children, ensuring that after the good matching has been done with parents and their and children around who have been identified during the DI process, supporting existing staff, ensuring that retraining and redeployment of new staff has been done, and building capacity of staff to be able to do the transition process successfully, as well as recruiting families and professionals to be able to support the children. Here we have, here we are able to ensure that we match the children's needs and ensure that successful transition happens. And also specifically around this, we ensure that children with disabilities and also young children that are below the age of 0 to 6 years have successfully gone through a thorough bit of the transition process, considering all the other steps, but at this level, priority is given to children with disability and also to young children. Also at most, when we look at young adults, they are another greater team to consider when it comes to the transition process and ensuring that the process is successfully done. We have the last part as monitoring and support. This involves the coordination and integration, case management and supervision, and it also has in an element of post-placement support and monitoring. At preparation and transition level, there's a lot we've done for the children, there's a lot we've done for the families, and the preparation has been thoroughly done. But then what after placement into the communities or into their families? There's another bigger range of work that awaits us. It doesn't end there. Continuously advocating for children that have moved out of orphanages. We've come to realize that at this level, usually that's when you see most of the challenges probably you never dealt with at preparation level coming out. How do you manage expectation at community level? All this happens during the time of monitoring and support and building a support structure around them, connecting them to the local resources and services around within their communities, and ensuring that they are fully enough linked to the services within, and they can even be able to share best practices with other organizations, also with other peers within the communities that they've been placed in. What models do we use as part of the preparation and ensuring successful DI is enhanced? We base our support on an active family support model. It is a holistic and unique model tailored to individual needs of each child and family, and it is built on the very main key values of respect, inclusion, sustainability, and best interest of the child. We look at partnering with these families to ensure that we create the best support system that we can ever have, and also it is within their best interest and also the best interest of the child. It usually requires us to understand exactly what are the needs of the family. Are we responding in respect to what they require and what they can also afford? Families are helped to assess their strengths and needs across the 6 well-being domains that we base on while we are offering support for these children. And the 6 well-being domains, in summary, we have family and social relationships. We look at how are we connecting them to the families to be able to improve their social relationships with their extended family, with their communities, and what could be the gaps, what can we support. We look at living conditions that mainly caters for rent, accommodation, ensuring they have clean and good housing. We also look at building and constructing for them, if that is the case. We also look at do they have food? Do they have clothes? All that is under living conditions. We also have in mental health and well-being. Mental health, well-being, and health in general. Here we mainly look at what is the family condition like in regard to managing, what is the family condition like in regard to their health. We are able here to pay for transport facilitation to the hospital, medical fees, and also being able to have some education around health, support mental issues, and psychosocial support to the families. We have in education. It's not a matter of taking a child back home, but are there resources in their communities that the child will benefit from? Looking at also maybe the effect that may have led that child into the orphanage. Here they are either in the community, they will begin comparing, understanding that, looking at are there enough services that will benefit these children. That is all that we look at, looking at the active 5 family support domains. Continue, please. Continue, kindly run through. We have one additional domain, household economy. What is the economy of the family? What are they able to do? What are the key challenges around their economic well-being? Can we maybe reinforce the family with an income generating activity to support them to continue running? But that would be up to what you've assessed, and again, based on their strength and ability and what they are willing even to invent, to involve themselves in to be able to continue earning a living, and also looking at sustainability for this family that has received this child. Is it an IGA or a business that would support them to continue, that would support the family needs in all? And one key element about active family support, the main entrant is the main entry point is a child who has been reintegrated from an orphanage into the community or into that family. But we look at the entire family. It is a holistic support for the entire family. When we look at these domains apply to every member of the family. It's not only that child that has been reintegrated. No, it's about the entire household. How can you revamp and improve well-being of that family to be able to successfully support and take care of that child that they've received? What key challenges around active family support? One, it is a resource-intensive model. It requires a lot of resources. It requires technical skills to be able to understand what are the needs of the family, what is it leading us in one or another. You may start it as a simple assessment, but it may lead you to understand into other perspectives of the family. For instance, skills training, what other community strengths do they have, requires commitment and real dialogue. It's not about just bringing an idea or just bringing an idea to our family. It's a discussion of both the professional and also the client or the beneficiary, who is the head of household or an elder member in the household, considering resources around within their community, connecting with their local authorities, understanding this family very well and see, am I making the right decision in regard to the kind of support I'm offering? Requires detailed information and individual assessment. This is where we do a lot of engagement and getting data from the local authorities, from the neighbors, involves communities at all levels. And active family support may not really be successful if you just bring a certain kind of support that is above, for example, the community standards. For instance, it's a community that has no more simple iron sheet houses, and there you are, you bring a tiled house in that community. It may lead to labeling that family to say that's the family that received a child from an orphanage. And at the end of it all, it requires a lot of negotiations and understanding what are the community values, what do these people respect, what is done, and what are the do's and don'ts of the community. Thank you. We move to the different community systems that we put in place, that is emergency foster care and foster care in place as part of one of the key gatekeeping mechanisms that we've ensured that support children. Foster care, one, we've looked at the key challenges that foster carers have indicated to us, and bit of it is that it's very challenging to get foster carers to receive children with special needs. And also a bit of the challenge is that foster carers usually require those, we receive those that have will, but again, we find that there is a lot that we need to support from them. So we look at what good practice with working with vulnerable children. One practice point out is prioritizing DI for children in residential care, specifically for children below 6 years. That's one of the very delicate age group that one would start with, especially while doing the institutionalization. Identifying vulnerabilities and addressing them early through models such as active family support is such a good practice, and inclusive interventions to support children inclusively, including children with disabilities as a special group. Then children need to be empowered to be able to speak out issues that affect them and receive adequate support about it.
Thank you, Karen. I think we need to bring this to a conclusion. You gave us a fantastic and very much in-depth presentation, and there will be plenty of opportunities to talk more about the process and the lessons as we move on. Thank you for your insights and for taking us through this very structured process that you have implemented in Uganda. It is now my pleasure to invite to the table one of our esteemed colleagues from UNICEF Tanzania, Mbelwa Gabagambi. I hope I pronounced your name correctly. You see, my name is Hope. It's 3 letters. It's very easy to pronounce. You are an amazing child protection specialist. You work with UNICEF in Tanzania, and you do have extensive experience in providing technical support to government and civil society organizations in establishing and rolling out child protection systems. And I think your experience and work in Tanzania, your analysis of the situation in the country will be extremely useful to giving us an understanding of where we are in the process of care reform in the country and how can we benefit from the lessons learned in Kenya, in Uganda, in other countries. So Mwelba, it is my absolute pleasure. Please take us forward. You have 10 minutes and I'll give you the 2 minutes warning. If you can see me on the screen would be very helpful. Thank you so much.
Thank you so much, Delia, for an introduction, and thanks also to my colleagues who have already presented. I'm so happy to be part of this forum, and I think this is indeed a very good opportunity to learn from each other and also present some of the experiences from Tanzania. And as you mentioned, I'm from Tanzania, and in Tanzania, we can say we have not started fully implemented a care reform, but there is already a very good foundation that had been laid down. And I think the country is currently ready to start the process. And what I'll be presenting is what has been done so far. So to begin with, I just wanted to begin by highlighting the regulatory framework that I think are very important when it comes to care reform in the country. Tanzania enacted the Law of Child Act in 2009, and this was a huge milestone towards not only strengthening alternative care in the country, but also in overall protection of children against violence, abuse, neglect, and exploitation. And through this Law of Child Act, there has been a lot of regulations that were developed, which are meant to support the implementation of the law. And there is a specific regulation on child protection. It's called a child protection regulation. But there are some other regulations that are specific in alternative care. And here I mean, for example, the children home regulation, the foster care placement regulation, adoption of children regulation. These have been already gazetted, but we have also the fit persons regulations. This provides opportunity for families to provide emergency foster care for children who need care and protection. And they support children by hosting them for a very short time. It could be a day, it could be 2 days, it could be a month, and for a maximum of 6 months. And we have other rules that are actually supporting children in conflict with the law. And here we have the approved school rules and the retention home rules. The approved school rules have been, they're still in a draft. They've been reviewed by the Attorney General. So we are still waiting for their gazette. So these are the general overall regulatory framework that are very specific to the alternative care, and they provide a good foundation for the care reform in the country. So with the enactment of the Law of Child Act in 2009, it was quite evident or quite clear that the protection of children has been clearly defined as a state obligation. And the law has defined what needs to be done by the state at the national level and also at the local government authority level. So for the national level, the law says the state needs to ensure the optimal and progressive implementation of the law and its regulation. And this includes the regulations on alternative care. And for the local government authority level, the law states that all government authorities shall have a duty to safeguard and promote the welfare of the child within its area of jurisdiction. And this gives the mandate or the obligation of the state to take full responsibility in ensuring protection of children across the country. And we use this also as an opportunity for getting the government to also prioritize in supporting all children, including children who actually need alternative care services. You will also therefore notice that the regulatory framework is good. The foundation is well laid out. Of course, there will be some opportunity for some amendments and adjustments as we move forward. But what is needed so far is the enforcement the general principles for child protection in the existing provisions, including alternative care provisions, as reflected in the different regulations that have also been drafted. There are just wanted also to mention other guiding documents that I think they are also providing good foundation for alternative care. The government has developed the national guidelines on children's integration with family. This has already been approved. It is actually being disseminated and implemented. There's the national guidelines for establishment and management of safe houses for victims of trafficking and violence against children. This has already been gazetted, and it is actually being implemented. Has been approved and it is being implemented. The government has also supported, has also developed the national standard training package for child protection. This is specifically for social welfare officers. It guides them how to deal with the different protection cases, including how to support children who are either in alternative care or need to be provided with alternative care services. And it has defined the key processes, for example, for supporting foster care, adoption, and also fit family. And this has actually, it's been trained by all social welfare officers who are seen as the key conveners or the key coordinators of child protection, and who actually need to promote and support alternative care services. There are some specific training packages for fit families, for example. This is one of the package that has been simplified in Swahili, and recently it has been reviewed to fit in the COVID-19 context. So in general, what I was talking was actually the key documents and the regulatory framework, but I just wanted to also highlight some few practice for alternative care in the country, in Tanzania. So most foster carers in Tanzania, they do want to foster children with a view to adoption. And the preference is mainly to small children. This is the trend, what is actually seen. And adoption and foster care is still very low. In a country of almost 50 or 60 million people, but you find there's only about 51 children that are being adopted or fostered per year. So you can see that the rate for fostering and adoption is very low. Recently, with the introduction of Fit Family Program, which is somehow successful despite some of the challenges that are still existing, but we have seen more than 1,500 children being placed under Fit Families, which is a family-based care arrangement since 2017. So you will see that there are more people placed in Fit Families than those who are being put in institutions or being put in institutions. By 2020 October, there were 179 children homes that were registered, and these were hosting 24,145 children. But the indication is definitely that there are many more children in institutions, and this does not even account for children that are not registered, or institutions that are not registered, which are also many. And we also noticed that funding for child protection, including for alternative care services, is very low. There hasn't been a recent nationwide assessment or review that was conducted, but I'm citing some of the information which are quite old. But in 2013, 0.002% of the budget at the local government authority level were allocated to child protection. Not alternative care only. This was for child protection, and this was contributed also by the lack of understanding of what child protection is among some of the key decision makers. So some of the interventions that they were supporting, they would say they would interpret as child protection services, but in really they were not child protection cases. And there was also confusion among the general services for most vulnerable children versus the specific child protection services. So also, while kinship care is one of the best family alternative care options, both the Law of Child Act and the protection regulations are silent on this, and this might be another area that might be distinct. There are only 2 children homes that are owned by the government. So, because I mentioned about 179 children homes in the country, but out of those, only 2 are managed by the government. And the government has been putting a lot of emphasis in managing and supporting the institutions that they own. And there will therefore be needed, there will be a need to also see how they can further support the children that are owned by other agencies. In 2012, there was a national assessment that was done in the country on the situation of institution care in the country. This was only on institution care, didn't capture the family-based care. And you will notice that there was like 282 children homes in the country hosting about 11,000 children, and only 31% of these institutions were registered. And they also included some few, like 9.8% of children of the institution of children were also above 18. The causes for institutionalization, including children living and working in the streets, the poverty issue, a conflict within families. And we also noted that 60% of the referrals were admitted by social welfare officers. That means almost another 40% were done by other professions, including by the relatives. So this shows that there's really a need to strengthen gatekeeping mechanism in the country and prevent all factors that promote institutionalization. The general challenges that we see in Tanzania, shortages of social welfare officers. This is very, very common. There are very few social welfare officers. The community also, they still use institutional care as a means for their children to access other social services in education. And even some of the owners of the institutions are actually promoting their services by telling the community that their children will benefit when they enroll them. The government limited planning and budgeting, and also the challenges related to implementation of the policies that have already been put in place to address drivers of institutionalization. We see some of the what we see as a building blocks. These are the things that we see as opportunities that already been put in place that can be, if well exploited, they can promote actually care reform in the country. The Law of Child Act, I think I've already mentioned it. There's already a good process in defining and establishment of the child protection system in the country. And this system is meant to address the whole protection issue, including how do you properly protect children who are already in institutional care or who need actually institutional care. And the Fit Family, I think this already mentioned as one of the best alternative care program that has done well, despite some few challenges also. But there is also a lot of training that has has been done to social welfare officers. Almost 95% of all social welfare officers have received the basic child protection training, which also guide them on how to support children who need alternative care services. And so far, the government is very committed and has already showed an interest and intention to develop what they call as an alternative care program, but actually it's really a care, engaging themselves into a care reform. And this is something that it is in the discussion, and we are hoping even from this workshop we are going to get some good experiences and something that they can also build on to what the government wants to do. What we see as the key the key recommendation, one, there has been a lot of mini assessments that have been done, but there's a need to do a holistic, like the national assessment on the alternative care situation in the country, capturing both institutional and also family-based care. There's a need to develop alternative care regulatory framework that is definitely aligned with the UN guideline on alternative care, and that should focus on strengthening family care, should address the drivers of institutionalization, would be improve regulations and monitoring of and supervision of children child care institution, and promote the institutionalization and family integration. And we should also advocate for an increased number of social welfare officers. And the good thing here is that there's already social service workforce assessment that is being conducted. It will also inform this particular area. And this is my last slide. The additional some of the few additional recommendations is the need to continue to build the capacity of social welfare across officers across the country, and specifically on the area of alternative care. And of course, increasing allocation of resources to universal services, and strengthening the interministerial collaboration, especially of course these key sectors like social welfare, social protection, education, health, and justice. The good thing is the child protection system has already started defining the roles of the different sectors, and it is actually an opportunity that the country can use to strengthen alternative care services in the country. Thank you, and I look forward to responding to any questions that may arise.
Thank you so much.
I will say asante.
Asante. Thank you so much. I really appreciated your presentation. And I think I really loved your recommendations going forward, because they almost form the perfect circle back to what Frederick presented as the key ingredients for care reform in Kenya. And you spoke about the importance of a national assessment, the key of refining and putting in place the regulatory framework in alignment with the guidelines and the UNCRC, the capacity building efforts, the resourcing, and last but not least, you mentioned something that I believe is so critical, this intergovernmental collaboration across departments to pooling resources to support children. We have had a wonderful first session. We are receiving a lot of questions in the chat, and I think also people commented on the relevance of your presentations and the importance of gatekeeping and other elements that you mentioned. So let's go and try and answer some of the questions. I will try and put the questions to specific speakers if they were asked as such. Otherwise, I will try and direct them or open them for us. We have about 8 minutes, probably now 7 minutes to answer these questions. But remember, we have another 20-minute slot of Q&A at the end of the full session. So the first question is about you, Frederick, and how people are asking, how far did you manage to move from institutional care to alternative care?
Thank you so much. And I think just to answer that, I link it to what I said earlier. For us, in Kenya, we decided to do care reform as a whole. And what we have done is that we have really tried to address different components. The gaps within care, alternative care, having the standard operating procedures, now training and recruiting potential foster carers in different counties, and also trying now to encourage institutions to consider that those options. But of course, now having the support of guidance and standards, that has really worked very well. We have seen in the 4 pilot counties that the government has been piloting, we have seen 5 institutions that have so far transitioned. And what we saw is that 50% of the children who came from those institutions could not go to biological families, and they have been placed in an alternative care, many of those in kinship and some in in foster care, but also we are seeing uptake of adoption now, the local adoption. Thank you, Ndongo.
Great news. And I have another question for you. I think it's really linked, and it's about what is the level of buy-in of the government of Kenya in terms of the care reform broadly, and how is that reflected from national to the local level, Frederick?
Thank you. You can just see my smile, because what I can say is that I think, as I said earlier, we spend a lot of time to ensure that government leads this, and the entire care reform effort in Kenya is led by government. And actually, it's a commitment from the senior leadership from the ministry that deals with children matters. And just to give an idea is that recently the government decided to standardize the care reform efforts by completing the national care reform strategy. And 2 weeks ago, that was approved and endorsed by the Cabinet Secretary, Ministry of Labor. And that's a clear commitment of that. And the CS, the Cabinet Secretary, was very critical that he wants to see Kenya move from institutionalization of children to family-based care in the next 10 years. So I can say it's a true commitment from the government. And we have seen consistency in terms of policy direction, actions, and also whatever we are doing. And they are taking lead. We are just supporting as civil society. Thank you, Ndongo.
This is brilliant. Thank you so much. This is fantastic news. Karen, there is a question about Uganda on deinstitutionalization. Are there any particular strategy that made the DI process possible in Uganda, given the differences in drivers establishing the orphanages? If you can take this question forward.
Thank you so much, Delia, and the rest of the speakers. I would consider the key strategies that have led to DI to be a success or to move at this level. It has been more of continuous advocacy and also looking at where government has been and where we are at the moment. There is a lot that has been done to feed into the different policies that support deinstitutionalization and also government buy-in and involvement, because if I consider like one district that we've been able to have transformed from any orphanage, that is Tororo district in Eastern Uganda, I would say there is a lot concerning how the district has understood deinstitutionalization as a process, and also they've taken lead role. And we've done this as a piecemeal. We've done it in Tororo, and we are currently implementing it in Pigi, a district in central Uganda, and we've seen it gradually improve as a result of consistent education, ensuring that they understand, and also the district taking a lead role of pronouncing how they really want care reform to be in their district. Yeah.
Thank you. Thank you so much, Karen. He's kind of leading by example and allowing the local authorities to be the champions for the change. I have a question for specifically for UNICEF in Tanzania. Belwa, if you can take this question, please. Placing children to feed families seems to be really very successful and working in Dodoma. Can UNICEF be in a position to continue supporting this program so that it becomes fruitful in the future?
Yeah, definitely. We are very much committed in this. That's why we have been supporting all of the districts. We are actually directly supporting like 39 districts across the country, and Fit Family program is included in as a package for child protection system strengthening, and we are promoting this. That is an area that should be done across the country. And so far, as UNICEF, we've trained at least one social welfare officer to more than 100 local government authorities in the country, so that they understand how to recruit fit families and support fit families, and also support the other social welfare officers in their respective local government authority to also properly place children to the fit family as a really successful family-based care option, alternative care option. So we promote this, and we will definitely continue to work with the government to ensure it is rolled out across the nation.
Thank you so much. I think there are a number of questions that are very specific to working with specific groups of children, supporting young people to transition out of orphanages and dealing with resistance, which will, I think, be part answered in the second part of our conversation through some of our presentations. But before we go there, I would like to put one question to all panelists, and we have very little time left in this first Q&A. How can the well-intentioned efforts of those involved in volunteer tourism in orphanages can be refocused or harnessed to create the changes being outlined by you all? Can you just give us across the three speakers few thoughts about harnessing volunteer tourism or dealing with?
I think maybe to start is to, the first thing that I would want to, I know volunteerism has been a big topic in this specific discussion of care reform, but what I can say, and I know discussion has been there, then how can we also educate people who volunteer on the positives and negatives of that action of volunteering? And the big question that should be posed is it really necessary I fly to that institution to volunteer, or there is a different way that I can be of help of those children in that institution? And I think it's a whole topic by itself. Thank you, Ndongo.
Yes, absolutely. Thank you. Any other thoughts? I know Becca had experience and wanted to contribute. We have about 30 seconds.
Sure. I think one of the things that our organization has done is really focusing on directing volunteers into community programs. So one of the things that comes up again and again is that people, children sometimes get left in care because their families are not able to provide certain services and they're not able to get them in the community. So we've really tried to redirect volunteers away from anything involving direct contact with residential children and really focus on the community programs for kids that do go home at the end of the day, and try to reduce the incentives for institutionalization instead.
Brilliant. And there are a couple of very useful resources globally, including Rethink Orphanages, that people can go, and those who are interested in contributing their skills or their energies to a noble cause of supporting children can find more appropriate ways to contribute. Thank you all for speakers for being so amazing in bringing us through the big picture of working with governments to deliver change both at national and local level. In this second part of our wonderful session, we are going to kind of zoom in on the grassroots organizations and also on examples of supporting different groups of children to transition safely into the right environment, the family environment for them. So it is my absolute pleasure to invite our next speaker to present the experience of the small things. Becca Roast-Russell is the executive director of the Small Things, an NGO created to empower orphan and vulnerable children and their families using the continuum of care. Becca will talk about a coalition. I think it's called Families and Futures. And we working to unite and empower the ecosystem of organizations focused on supporting children and families across Tanzania through access to programs, training, best practices, and shared specialist services. Becca, please.
Thank you so much.
You have 15 minutes. We'll do the same kind of strange, if you can see me, it will be great because I'll show you 2 minutes left.
That sounds perfect. All right. So let's get started. So Delia spoke a tiny bit about the organization already. As she mentioned, the Small Things is an organization it was founded about 10 years ago. We began working with a woman who's been caring for children in the community for more than 30 years and really have been lucky to have her guidance through the whole process. We have more than 150 children we've kept at home for family preservation and business development efforts. That's our primary goal. We have about 38 residents currently in family style housing at a children's village. These are mostly children who, for whatever reason, are unsafe to return to their families. We have 39 children. We just passed the tipping point, which was very exciting, who were formerly in residential care, but who we've now been able to return home. And we support about 1,300 community members via education and microfinance programs. So that includes weekend tutoring, a daycare program, things like that, to try and really keep, like I said, reduce those incentives for children to end up in care and make sure that the community is supported. So this I'm just going to zip through because I think most people here are aware of it. But essentially that orphanages in Tanzania came about largely in response to the HIV/AIDS crisis, really just, killing a huge number of people in the generation that traditionally would have taken responsibility for orphan children. So mothers, sisters are your big and little mothers, your dad's brothers are your big and little fathers. Traditionally that was more than enough. But during this period, that no longer was the case. However, we've seen in the last few years, the number of children who have lost one or both parents has declined significantly. But the number of kids who are living without either parent is up by 20% to an all-time high as of 2016, which was the last year I could find data for. So essentially, it's an ongoing problem and it's not going away. The numbers are very hard to find, as others mentioned. These were the numbers I was able to find from different sources. But essentially, the problem isn't going away immediately. We can't transition immediately. And funders are rightly, I think, moving away from funding orphanages and residential care in an uncritical manner, which is absolutely an important step. However, they aren't really replacing their replacements on the ground. They aren't really funding their replacements yet either. And so what's happening is that these organizations are ending up really squeezed and don't have the resources, often don't have the resources to continue their existing programs, much less transition to more effective family first models, particularly for locally based and grassroots organizations. So according to a recent survey in the Arusha region, 78% of organizations have no trained caretakers. 60% struggle to pay for basic needs like food on a monthly basis. 50% have no managers or professional staff. Half have no license, and only 11% have exit plans for the children in their care. In terms of the family preservation side, when we've been doing these surveys and site visits with over 50 organizations in the area, around 95% of them agree that family preservation programs are important, that they want to be part of it, that they believe it's part of their role. Around a quarter of them previously ran programs that were aimed at family preservation and had to stop them because they weren't successful. Around 22% are currently running programs, but only 16% are happy with the effectiveness of their current programs. And that includes the small things. So it's a pretty small number at the end of the day. So our proposed solution is to create a coalition of organizations working together, which can democratize and decolonize access to high quality trainings and practical support in order to help grassroots organizations improve their quality of care and move towards family first models. So essentially, in addition to the high level support provided by the government and international organizations, this is meant to be kind of a bridge to bring together organizations doing the work on the ground and provide that really practical support. We share a commitment to keep children and families if safe, return children to families whenever possible, and care for them in family-style environments when absolutely necessary, as a last resort. Based on our experiences at Small Things, we've put together some targets that we think, again, in concert with other organizations in the area, that we think are feasible, and our wonderful social welfare team in our region. We believe it's possible to prevent around 90% of at-risk children from entering residential care via family strengthening. We found it's possible to return at least half of kids who are come into care as infants after losing their parent in childbirth, are usually able to be returned before primary school. About 75% are able to be returned by secondary school by the time that they enter secondary. And that reserves long-term care as a last resort for children who've been abused, neglected, or completely abandoned, and for whom an alternative foster or adoption placement was not able to be found. So how does that work? Essentially, we plan to structure around a set of regional hubs throughout the country. The kind of main elements of the proposed program of the coalition involve a comprehensive referral network, looking at toolkits and trainings, and getting into specialist teams, so services of professionals that most organizations need but can't afford to hire independently, things like mental health support, disability care, things like that. We also are working on monitoring and evaluation, making that super accessible and easy to implement, mentoring partnerships, and financial support packages in the long run as a mechanism for funding these transitions. So the hubs are kind of the core driver of change through the coalition. They're meant to really actively fight that scarcity mindset and competitive approach, and really focus on how we can work together and be most effective. So in the short term, in the coming year, we're working on a hub in the Meru district. Again, working on that referral network, really trying to just map out exactly what's available in the community, because most organizations don't know where to turn if they can't support a particular family or child. There's not a lot of knowledge about what else is out there. Toolkits and trainings are meant to take some of the really wonderful resources that have been created by our partners at organizations like UNICEF and USAID, and really adapt them specifically to the Tanzanian context, and make them as accessible and kind of plug and play as possible. So all materials in Swahili and English, sample procedures, sample criteria, sample forms, really get down to make it as accessible as possible. And then the specialty teams. In our surveys, these are the needs that came up over and over again: mental health and counseling support, support for children with disabilities, both physical, mental, and learning, and support in reunifying and preserving families. In the long term, our goal is to spread these hubs and services across Tanzania and become a major source of funding for effective OVC care. So part of that involves monitoring evaluation app. We actually are collaborating with Citizens for Change and hopefully with Child's Eye Foundation on adapting some of these more general models to make it really accessible in the Tanzanian context, getting some of those basic case management tools all digital and really able to be implemented easily by individual organizations. The second part is mentorship. So really looking at seeking out those organizations that are doing really good work, and having them designated as training partners that serve then as mentors to organizations that are looking to implement their own programs. And part of the way to make that happen is to provide support packages that give financial incentives both to the organization that's implementing these changes, as well as the organizations that are providing the training. Because I think one of the major barriers we've seen in the past is there's a need for a lot of sort of volunteer and donated time and resources from the larger organizations. And the truth is, we're all struggling. Even the organizations that are doing well often can't donate, tens of thousands of dollars worth of training on an average year. Over this past year, we have had meetings, site visits, and 2 larger conferences involving over 50 local organizations and a huge number of government and social welfare representatives who've really been able to just talk in a lot of great detail about what are the challenges that people are facing and how can we most effectively mitigate them and help to keep children at home and with their families. And based on those conversations, we've come up with a set of sort of 4 core needs that we hope to implement at our initial hub, our pilot in the Usa River area. Essentially, again, the specialist teams looking at children's education, open education to support and remedial and enrichment education, adult and business education and microfinance access, and then most importantly, in my opinion, as the organizational capacity building. So really just working with social welfare on creating and running free trainings that help improve residential care, help organizations implement family preservation programs, and include things like HR and administrative capacity building that are often overlooked, but are so crucial. Part of that also is that not all the services are provided by TST. We have a large group of excited organizations who are ready to help provide trainings and services to a larger venue once they're being provided with the opportunity. So just to give a quick overview of our timeline, we've been spending this past year doing a lot of preparation, research, speaking to people, really fleshing out the model. This coming year, we're working on internally rolling out with our first partners and aiming to open up to other children and families from the communities. And then looking by 2023 to be full scale running capacity program building services and have independence funding for the first implementation partnerships. If things go well, by 2024-25, we'd love to be expanding across the country and improving from there. It takes a village to raise a child, and it's going to take a coalition to transform a childcare system. We've been lucky to have a lot of really wonderful advisors through this process. We hope that they will continue. And we also have a long list of wonderful local partners, but we won't get into that right now. I think everybody has been very patient. So thank you everyone for listening and for sharing with us. And I really am hoping to connect with people later and help move this project forward, because we've got the momentum, we've got the buy-in, we've really got everything we need. We just need a little bit more, fuel and momentum, and we're ready to make that change. So thank you so much.
Thank you so much, Becca. I really take forward some of these brilliant ideas, and I just want to highlight a couple of key principles that you highlighted in this approach. I love that grassroots level collaboration, moving away from a mentality of scarcity to actually pulling resources and expertise. And I love the focus on actually looking at the areas where maybe the service is not as rich, and the availability of specialist skills will make a huge difference to ensuring that children are not unnecessarily separated from families. I'm sure there will be questions about how do I join and how do I contribute. So we encourage everyone listening to think about it. It is, and thank you so much for being on time. I think we're just catching up a little bit. The next speaker is Georgina Harris-Hill, the founder of Pamoja Leo Children's Charity, working to transform the care for children in Tanzania. Georgina is the mother of 2 fabulous children who remain the greatest teachers. She's an avid traveler and lover of cross-cultural living. And she will talk about a really important group of children, transforming care for orphan and vulnerable children and supporting the children under the age of 3 to growing up in a family environment. Georgina, you have 10 minutes.
Thank you. So I'm talking to you today from Tanga in Tanzania. And I just want to thank everyone that comes before me, because I really think care reform starts in a conversation. And that's always been my experience. So I'm so honoured to be part of this conversation. Pamoja Leo for the non-Swahili speakers means together today. And I think togetherness is a really important theme, hopefully that will come out through the talk I'm about to present. Pamoja Leo works specifically with children aged 0 to 5 and also children of all ages who've experienced sexual violence. We have a number of programs, but today I'm going to be specifically focusing on the Baby Project and A Family for Every Child, specifically our work around fit person care for children. So what are we tackling as an organisation? I think the very first thing is why under 5s, and we get asked that quite a bit. And what research shows us is they're both most disproportionately impacted by institutional forms of care, but there's also a beautiful opportunity when we get to intervene with younger children to both help to prevent damage, improve resiliency, and also to secure their position and place within their family networks. Pamoja Leo works on both prevention and creating alternatives. So prevention such as providing free daycare support to children living in kinship care, and alternatives, as I said before, such as fit persons, which for those that, I think other presenters went into it a little bit, but in Tanzania, that's emergency foster care. Sorry, technical. So where did we start? The Pamoja Leo started mostly with a question. Why are children in orphanages? What happens when they get there? And our very first project was a data project in Tanga district, where we went about surveying every child living in a children's home in collaboration with District Social Welfare Office. We then scaled that up to a regional level, and we developed a digital database and case management system based on the Tanzanian health monitoring system, and started using that for monitoring children in children's homes. The data told us things like why in our region are children under 1 falling into orphanage care. And what we found from there was that the big trigger point was maternal death. And from that, we started developing a series of prevention services. As I mentioned before, and I'll go into a bit more detail, things like our Baby Project. From there, we started to work a little bit more around the advocacy and buy-in to how can we start to change the way we care. And that started with a conversation with all of the different children's homes that we'd surveyed previously to start again listening and learning to what their experiences are and where the knowledge gaps fell. Our next point was to start developing and creating alternatives, and that was specifically focusing on fit persons care. And then finally, we've started just recently supporting orphanages who want to reunify children with some of the support to do so from Pamoja Leo's perspective, children under the age of 5 that we particularly help them to reunify. The Baby Project was about finding a way to stop infants aged 0 to 2 from entering orphanage care. And it's been a hugely successful project. To date, we've helped 88 babies in the last couple of years whose mothers have either passed away, whose mothers have experienced serious crisis, or the child has been abandoned and found without any caregivers. And we've helped to support to place originally with biological mums in kinship care. And we were able to address some of the needs that the children faced, which was leading them into orphanage care. One of the big ones was milk, but other things such as wraparound care to families who often were scared, stressed, and overwhelmed when they suddenly find themselves the caretaker to a tiny baby, and the psychosocial support that we provide families so that they can bond and attach to the child that's now in their care. And what we've seen here is an amazing success where all the children actually remain with their kinship caregivers because they've been allowed to really take that child on as their own through this intensive support. But what happens when some babies don't have a family to stay with, when there is no one to work with? And that's when we started to do more work with looking at alternatives. We started working at a district level, and we've since gone up to working at a regional level with this. When we first started out 3 years ago, there was not really much going on in the fit person landscape in Tanzania. So it was a lot of frantic phone calls to others in the region. But we started to develop some basic principles. We started to consider that interventions are a choice, and how are we going to start choosing the way that we go about and the types of conversations that we're going to start having with all of the local actors. We also realized that there was a conversation about meeting needs whilst protecting children's rights. And we found this kept coming up a lot. How do we balance a child's need for milk, but their right to a family? How do we have those conversations? These were essential in our early days when we started talking to the government social workers about this. It was also important to reimagine the role of the NGO. We kept finding that there was a real push for us to take on more of a role. And we had to keep stopping ourselves to say, no, step back. Let's see, make sure that we're always cognizant of who's doing what here. The challenges were many. Stigma. Tanzanians don't foster and adopt. And a spoiler alert, I'm here to tell you that they do. Funding was a huge problem. This was something really difficult and challenging to fund. The lack of a blueprint, and there was a huge resistance as well. We found that there was resistance from all different angles to trying something new, which is normal. So some of the design features, we worked with district social welfare officers to recruit, train, evaluate, and then subsequently place children into fit person care. Fit persons in Tanzania is a voluntary role, so their carers are not financially compensated for this. But what we did put in place is some design features, such as every child we provide a comfort kit to, which has their essential needs in to reduce some of that financial shock. And we do extend some of our family care services to fit persons, such as access to free formula milk and daycare services for those fit families, so that they also have some of that reduced financial burden. Key successes. In the last 2.5 years, we've gone from 0 to 99 fit families in the Tanga region. And we're seeing huge changes to the way that children are cared for. We're seeing babies go from found abandoned in the street, taken to the hospital, where their fit mum turns up and takes over their primary caregiving duties. We're seeing that that baby never spends a single day in the orphanage, where they go from either fostered and into an adoptive placement, or they're found some kinship caregivers. We're also seeing the incredible role that fit persons play as child protectors themselves. We have had fit mums walk alongside children who've experienced very severe abuse in their biological families and provide really unimaginable levels of psychosocial support that you can't replicate. That these fit families are incredible sources of support, and they're part of this larger ecosystem of child protection. The challenges. It still remains really hard to fund as an intervention, especially we're at the point where we really want to scale up. New things are hard to adapt to, and we found that that's taken some time to kind of iron out some of the learning. We have, in 2020 and 2021, every infant under the age of 2 had been placed in family-based care until very recently, when we had a child, a young child who had very complex needs, and we were unable to find a fit family that could accommodate for their disabilities. And that was something that remains an ongoing challenge to accommodate for. And we also find that we still need to have a conversation about gatekeeping. Just because prevention services and support services exist and alternatives exist doesn't mean they're already used. And this is part of a much larger conversation within Tanzania about the potential to have these smaller grassroots interventions plug into a larger conversation about a clear continuum of care framework within Tanzania and a real need for supporting gatekeeping. Quickly, lessons learned. This is all about creating an ecosystem. When it comes down to the child, creating a huge team of supporters. And when it comes to fit families, they also need an ecosystem of support. Social workers, practitioners, NGOs, and I think the wider community that care about children. This is all about connections, and we've seen the importance of that as we've worked through this. Nurturing relationships with early adopters was also a key lesson that we've learned. At the beginning, there was a lot of people that said, this is not going to happen. But it actually came down to one government social worker, one fit family, and working intensively with those early adopters and sharing the successes together was really important way of moving forwards. We've also found that keeping our eye on the clear goal, that this is possible, that we're seeing the successes and sharing and building upon them is possible so that we can create a Tanzania where every child under 5 has access to family-based care. Thank you. I'd love to connect. That's a celebratory balloon for me getting to the end. And please do get in touch if you're interested in fit family schemes in Tanzania, working with children under the age of 5. Thank you so much.
Thank you so much, Georgina. Thank you for sharing your experience working with this extremely vulnerable group, a group of children who do not have any time. They need to be in a responsive one-to-one relationship to enable their development and reaching their potential. Last but not least, in our list of amazing speakers in the second part of our conversation, I am inviting Rose Kagoro to present her work with Railway Children Africa. Rose is our advocacy manager. And not only that, she is basically leading the care reform work with Railway Children Africa that supports orphanages in reintegrating children to family-based care, transitioning their operating models, establishing new networks of CSOs working together for care reform, sharing their experiences and learning. Rose, you have 10 minutes. Please talk us through the challenges and the lessons learned through working with street connected children.
Thank you so much, Delia. Thank you to the previous presenters. So I see time is up and I'm going to be a little bit quick in my presentation. So I'll be taking you through the Railway Children's Africa experience in providing alternative care for street connected children. So before we get into our experience in providing alternative care for street connected children, just a little bit background of our family reintegration work. We at Railway Children Africa believe in a world where no child has to live on the streets, and we know and believe that children need a safe and a loving family to thrive and access support services. But of course, we understand because of different challenges that happens in families such as violence, abuse, neglect, and economic hardship, majority of children have been forced to take to the street, where unfortunately they continue to experience these challenges. And so we understand the process of reintegrating children into families and communities is complex because these children have complex needs and requires time and specialist support to be able to support them. And so we adopted, we are using the family therapeutic model borrowed from Mukoni that support the families to reprocess their experiences, but also change the patterns of behavior and the way they relate to each other. So a quick snapshot of our experience and achievement in our integration work. So between 2018 to 2021, we have been able to reintegrate 1,765 children into families and communities. And when we continued following up on these children, 80% of them were thriving in families and in education, whereas 76% of the families in the reintegration program reported improved relationship, and 64% of the families received economic support. So because of this success and experience in our family integration work, we believed we could replicate this experience into reintegrating children from orphanages or long-term care. And so in 2019, we received funding from UBS to support us implement an alternative care project that aimed to support us to strengthen our reintegration work, but also strengthen our prevention work using the ACT parenting program, support LGAs to establish a cohort of fit persons, but also support orphanages to transform away from becoming long-term residential institutions to short-term or implementing community services, but also support them to transition the children into family-based care using our family reintegration model. We also used this funding to start implementing or establishing a CSO platform for CSOs within the country to share experience and learn from each other. So this presentation is going to focus on the third, fourth, and fifth areas. The first area has been covered earlier today by my colleague, and the second area on ACT to be covered, I believe, in tomorrow's sessions. So Street Connected Children Home, the return of Street Connected Children home requires them to be rescued from the street and be placed in a family environment where they can be able to thrive, while we continue working to resolve the challenges that led to their separation with their families, or we continue to explore alternative family options that they can be taken to. And so because of that, in 2018, we collaborated with UNICEF to support the government to develop a fit person training manual that was to be used by the social welfare officers to identify, but also recruit and train the fit persons, as well as follow up the placement of the children in these fit persons. And in collaboration with our implementing partners across the 6 cities that RCA work in Tanzania, we have been able to train 205 social welfare officers from 22 local government authorities, but also we have been able to support the social welfare officers from 13 local government authorities to identify and train 312 fit persons. And so a quick snapshot of our achievement within 1 year period in implementing the fit person intervention. So from 2020, where we received the funding from UNICEF to strengthen our fit person work, we have been able to place 493 children into fit persons care. And as a result, we have also managed to reintegrate 393 of these children with their families, or with their parents, or with their extended families. But also we have managed to, 40% of these children are still at fit persons care because we are still trying to resolve the issues that led to the separation, or we are still trying to trace the families. And 55 children have dropped from the fit persons. I think it's also important to talk about the dropouts that will happen when we place children into fit persons or into their families. So our lessons throughout the journey of implementing the fit persons intervention is that fit persons for street connected children need a good selection process to make sure that they are ready to welcome and care for street connected children. Because when we started, we had experienced that many of the fit persons were refusing to take care of for street connected children. And so related to that, we ensured that we provide additional and regular training to these fit persons so that we can be able to support them with skills and competences to care for street connected children. It's also important to consider, like I said earlier, that there will be breakdown of children that we place to fit persons due to a number of challenging situations. And we make sure that we follow up with the children that have dropped from the fit persons to understand the reasons why they dropped out. The other lesson we learned is that the social welfare departments, specifically the social welfare officers, need resources to be able to implement this fit person intervention. Currently, because there are some development partners such as RCA, Pamoja Leo, that are interested in this intervention, so we are able to support the social welfare officers. But what happens when RCA is not there, or when Pamoja Leo is not there? I think it's also another issue to look into. The other lesson we have learned is that Options for street connected children need to be considered, and a range of options need to be available to respond to their needs and circumstances. We need to understand not all fit persons will be able to care for street connected children. So we need to identify the ones that are able to provide that support, like I said earlier, and capacitate them to be able to do that. And because of challenges and the lessons that we have learned, we are further assessing the key protective and risk factors associated with the successful placement of street connected children to the fit persons. And we hope when the finding for this study are out, we'll be able to share with the wider audience and raise a dialogue around that. With regards to our experience in supporting the orphanages to transform, some of the lessons we have learned is that the resistance will always be there, so we should not underestimate that. For our experience, it took us 1 year to be able to get just one orphanage that was willing to work with us. The other lessons that we have learned is that these children's homes we engage with have started transitioning, and actually one of them is ready and willing to transition. Of course, the 3 others, we are still into dialogue and engagement with them, but all of the 4 orphanages have started reintegrating children into families and community. The other lesson we learned, majority of children from these 4 orphanages have either one parent that is alive or have extended family members. It's just that the children are taken to these institutions because families believe they will receive a better care at their institutions compared to the families. Also, the success of the transition of and reintegration work has made our partners very proud. So when we conducted a very rapid evaluation to evaluate our work so far in this area, and some of the results we received is that the partners are very proud of the work they've been able to do. Of course, while in our case, we saw that the process was very gradual, but for them, it was very interesting and they were proud of it. Also, the success of transition was a reflection of the strengthened skills and capabilities of the staff in these institutions. So we provided trainings to these institutions, especially to the social workers on family integration and also on case management. And this supported the work in reintegrating the children into families and communities. We have also been able to place 2 children under adoption. Of course, as Mbelwa said, the number is still low. On average, 51 children are being placed in adoption countrywide. So some of the achievement we have had is that also we have been able to reintegrate 66 children from these 4 orphanages. Of course, we followed up to these children a year after, and 12% of the children, which is 80 children, are still at home. They're thriving and they're in education, and 64% have been able to stay at home for more than 6 months, and the rest of the children have less than 6 months since we reintegrated them. So some of the challenges we have faced, or we continue facing in working with these orphanages, that as an organization, we lack a first-hand experience in DI because we ourselves, unlike maybe Child's Eye, we have not gone through the process. So we lack that experience that we can share with these orphanages. But also the social welfare departments in the councils we work with, and of course, across the country, are under-resourced. And so it's a challenge if we do not have resources and organization to support them. It's a challenge for social welfare officers to fulfill their responsibilities. Most of the long-term care homes in Tanzania are started and run by individuals and are not registered. And of course, they do not have governance structures and system. And this is also a challenge, especially when you have donor funds that has a lot of requirements on how to be managed. And these institutions, they don't have structures, they don't have systems. They're run by individuals that decide what needs to be done in the organization. The other challenge is that care reform is still not part of the child protection system strengthening agenda in Tanzania, but also we face and we continue facing a challenge of reintegrating children with disability or children with mental health issues. So this is a challenge because even placing them in, for example, in a fit person is a challenge. Of course, because also one is because we don't have expertise on how to go around that, but also secondly, we also don't know how to support the fit persons and the families in taking care of these kind of children. Another challenge is that alternative care options such as fit persons, adoption, and formal fostering are not known within the country. It's only in those districts or areas where there are development partners that are interested in these alternative care options that either the government officials or the other CSOs are aware of this. But in areas where there are no development partners, these kind of options, care options are not known. There's also a difference between what the law stipulates when it comes to fostering and what is being practiced. Here in Tanzania, fostering is only when someone wants to adopt, but that is not the case with regards to the foster care regulations. You can foster even if you're not intending to adopt the child. So our final reflections when it comes to supporting orphanages to transform is that DI takes time, and so it's important when we design projects or programs, programs for DI, we factor in enough time. And also another reflection is that readiness will always be different for each orphanage or organization, and so it's important when we design the engagement strategy, we factor that in as well. And ensure that these orphanages have an alternative purpose that they can do when they decide to transition. It's also important that family and community-based intervention are established alongside their integration work, so that to support the families' interventions such as family strengthening, economic family strengthening interventions, or parenting intervention to support the families and communities in caring for the children, also avoiding separation or children ending back into institutions. Other reflection is that successful integration is not a guarantee that orphanages will always commit to change. I think when we faced the challenge of getting an orphanage that was willing to work with us, we decided to sell more the reintegration work, hoping that it will convince the orphanages to change at the end of the day. But this has not been the case. The orphanages have continued to remain with their stand. Those that were willing to change from the beginning have continued to remain with that, and those that were not willing have also continued to remain with that stand. Another reflection is that there's no one size fits all plan when it comes to transitioning orphanages. You have to have a different plan with each of the orphanages depending on their level of readiness, but also their level of understanding and the situation on the ground as well. The strategy for lobbying through donors and boards will not work for many of the orphanages in Tanzania because they don't have the boards, nor do they have international donors. So when we first started learning about how to support orphanages, we learned that you need to lobby through the donors and boards. But when we came into the ground and start implementing the work, actually, we found that these orphanages, majority of them, they don't have boards, they don't have donors. So who do we lobby? And the person that you're into contact with is the owner of the orphanage, and they are not ready to transition. Another important thing is that community awareness is a very critical element of any DI work, because while we try to convince the orphanages to transform, communities still believe that institutions or orphanages are best place for children to be because they can receive all kind of quality services. Also, it's important to get the local government buy-in, and whenever possible to have an MOU with them and make sure that they're involved in all reintegration cases and they follow proper case management, and also make sure that they take the lead in implementing the DI work. It's very important, especially when you come into contact with orphanages that are somehow resistant. Also, making care reform. So we are, like I said earlier, this project we are implementing supports us also to set a platform for CSOs to come together and learn. And so we believe that making a care reform a national agenda requires collective efforts. And I think everyone that has presented earlier has talked about this. It's very difficult for one organization to champion the care reform within the country. And also RCA, because we are trusted at national and local level, we believe we are well placed to coordinate this CSO platform that will bring together larger and smaller agencies or organizations to model out our guidelines and regulations within the country are being implemented on the ground, and also share good practices. And lastly, we hope this platform will also support NGOs and CSOs to collectively alleviate and amplify their works, their voices in terms of what works and what does not work and what needs to change to the government. Thank you.
Thank you so much, Rose, for such an interesting presentation, especially with its focus on street-connected children and the challenges that it entails. We have 11 minutes left, and thank you so much for all those attending, participating, and so actively engaged in this conversation, for accepting to be online for 10 extra minutes. I will try and bring everything together in connecting the regional rich experience and all the lessons shared here with the global experience. And I think I feel really happy that there is a very clear alignment of thoughts and experiences. I've been involved in this work for over 22 years across the world, in Eastern Europe, in Africa, in Latin America, and Asia. And I am trying, my mission is to make sure that we are not reinventing the wheel and we are not repeating the mistakes that I've already made and many others across the world. So what are we learning from the global experience in care reform? And one is that we need a long-term vision. I think Frederick spoke at length at the importance of creating that vision in partnership with the government. We need to tell the story. This is not about technical jargon. It's about children growing up in safe and loving families. We need to move away from our story of rescuing children to actually supporting families and empowering families to be the best that they can for their children. We need not to import solutions. We need to learn from lessons, but we need to build on the rich traditions of care of each country. It's really important to understand the context. It's important to understand the realities of separation, who could be so different from district to district, from region to region, even within one country. It is also very, very important, and everybody highlighted the importance of collaboration. Our ministries are usually the poor sister. They have the smallest budget, they are less resourced, they have very few people across. We need to give them a platform so that they connect across with other ministries, with other NGOs, with communities. This work can only be successful if we encourage this collaboration. And all the speakers so beautifully highlighted the importance of collaboration at all levels. I think we need to make sure that everything we do is transparent and accountable. A lot of this deinstitutionalization process leads to decentralization of power, decentralization of resources, moving away from a central point of collecting and warehousing children or supporting children to moving those resources back to communities. We need to make sure that communities are prepared and we support them. We give them the skills and the resources that they need to be able to carry on the reform. We all know, and we spoke about it, that there are significant challenges around supporting children with disabilities or children with behavioral challenges or children who have spent their entire life in an orphanage back into communities. So if we know that, let's start planning with them in mind rather than reaching the conclusion at the end of the process. Let's start and make the change for all children. One big lessons learned internationally is how important it is for us to not to set revolving doors, making sure that the reunification of children leads to a transformation of service. And Becca and Georgina and Karen and Frederick and Belwa, you all spoke about transformation. You spoke about redirecting resources, helping people to find a new purpose. Time is of essence, prioritizing certain groups of children for whom we know that the residential care environment, no matter how well resourced is not the best place for their development, is absolutely critical. But at the same time, let's get ready. This is a marathon. It's not going to finish in a very short cycle of time. Follow the money. And Rose spoke about the challenge of actually talking to donors and talking with those who are supporting orphanages and helping them reallocate their resources. I think there is some fantastic work done by Change the Way We Care in Kenya, looking at mapping the funding streams to the whole ecosystem of residential care. There are other examples in different countries that could be utilized to enable us to understand how best we can harness the resources that we exist and are already there. I think one of the last reflections always is about any successful reform had a very good measuring what matters system in place. As simple or as complex as the system in the country was. Last but not least, these are kind of important reflections around influencing system change, because that's what we want to do when we engage in care reform. Number one is really critical for us to understand the context, to understand ourselves, to know where our biases, where we are coming from, where are our areas of maybe a lack of confidence, because those would be reflected in our work with other people. I think it's always really important to think systemically. Whatever we do in one community, whatever we do to support one children will have an impact in the extended family, in that community, to other services that are around. So it's really important to embrace this systemic approach. It's never prescriptive. And Frederick, you used the word roadmap. I embrace that fully as well. This is more like a roadmap, and you don't know, you have the end of the journey, you know where you are, especially if you do your national assessment, and then you plot your way through this with a view to achieving your goal. Learning and adaptation and being aware that you're gonna make mistakes is really important. And last but not least, I think it's really important to recognize that change is personal. Those who are supporting orphanages, those who have invested maybe a lifetime of time and resources into developing those, have come to that with most with good intentions. So it's really important to recognize that change requires quite a shift, and we need to go where people are to enable their transition into a new system. I hope I managed to very fast, and I do apologize if I was too fast for those who translated, capture this amazing wisdom and the richness of your regional lessons and connect them with something that we've learned at global level. Now we have 4 minutes left to answer a couple of really important questions, and they are all focused on children, those who benefit from our work here. So I would like to, if everyone can open their microphones, especially if they're in a quiet place, it's easier, and please jump in. How do you work with youth in institutions to get their documents, their birth certificates, when the information that we have about them is very little? And how do we prepare them? They have attachments with people in institutions, they've spent their entire life in that environment. What is the recipe for a successful support for young people living care? Anyone?
Can I start? Thank you so much, Delia. Yeah, I look at that question as one, considering what is on ground in terms of data. What have you found in the orphanage as data available on the children that will lead to your successful or unsuccessful assessment? Then working with structures around who are their caregivers, the owners of the orphanages, who are those people they are attached to most, and also engaging them in various sessions, because most of them, especially the youth, the ones who have reached an advanced age, the fact that they've really stayed long in their orphanage, they've lost track of their history and all that. You use the resourceful knowledge of those around that maybe placed them or available information. And then it is a long process because it requires a lot of thorough preparation. One child's readiness may not be, their time of being ready to move out may not be the same time the other one is ready. So I look at all that. Then another bit is working with local structures available. We've come to realize that a number of them have been placed by the local authorities within that area. Due to the pull effect of the orphanage, you find that even most of them come from that same district. So who are the structures around in terms of local authorities? It will help you to do tracing and even be able to manage understanding how to get most of this information, especially their personal data, for instance, birth certificates, that kind of thing. Then another thing I would recognize is that most of them are registered under orphanages. They don't have where they belong as a family, like the way a child would be born and maybe I'm born in the family of Karen, so I'll be registered under that family name at birth. Most of them are registered under the orphanages. So how do we detach this? Looking at the structures within for government, for example, like the National ID Authority, to ensure that some of these children are structured into the system that is existing.
Thank you.
Yeah.
Thank you. Thank you, Karen. Becca, you wanted to add something really briefly?
Yeah, I think one of the things that we found in moving from we began working with an organization that was an orphanage and then created the family preservation model and the children's village model later on after reunifying as many kids as possible. And one of the things that we found makes a really big difference is just relationship and expectation management from the very beginning. So the moment a child enters residential care, we begin the reunification process. So it's always part of people's mind that this is not a permanent solution. The child is, 90% of the time, the child is going to go home, keep up the relationships, but with school, because it's over school holidays, we pay for transport for families from further away to come and visit the kids. Just try to really break down any of those barriers that people have that make it more complex for them to keep up those relationships and
Thank you.
make it as easy as possible.
Thank you so much. And I think there are plenty of resources available to looking at how best one can support young people to leave care, including guidelines that were developed by young people with lived experience of care who are advocates and advisors for many organizations. Now, Rose, I'm going to put you on the spot because you spoke about the time you needed to engage with orphanages. How do you support an organization to improve their services and transform the way they care for children? What kind of support you provide? And what are the main challenges? In 30 seconds.
Thank you, Delia. So we support this. The first support we provide to these orphanages, as said earlier, is we provide training to the social workers, the case management training, but also reintegration training. But also we make sure that to each orphanage that we work with, we place 2 of our social workers with the orphanages to support these social workers of these orphanages in understanding the approach and methodologies that we use, the tools that we use with the children and with the families. But also in terms of supporting the orphanages as a whole, we are also trying, like I say, these orphanages do not have systems. So when you go in and tell them you need to follow these, for example, financial systems, they don't know that. So we capacitate them also in building the organizational systems as well.
Thank you so much, Rose. And I think, Frederick, you wanted to add, probably to refer to some of the resources that you developed, please.
No, I think you already mentioned it, and these resources developed by young people with lived experience. They're available online. But also the other thing that I wanted to mention, it's also important for the panel and everybody to note, not each and every young person who has overstayed in the institution will fit in a family. Some of them, maybe we might consider what we call supported independent living, because maybe they're 17, 18, and maybe they cannot fit in any family. So that child assessment is very critical, just to determine what are the specific needs and what does the case plan tell us. Thank you, Ando.
Absolutely, very good comment. And I just want to say that there are a lot of resources available. Most of them are on the Better Care Network under the Care Reform banner, and you would find guides for transforming care, guiding institutions, all sorts, including those specially designed for faith-based organizations. Okay, I have one question for Georgina, if people can hold on. It's a really important one, and I really appreciate everyone's patience. How do you manage feed persons' expectations? What have experienced? What are the expectations, and how did you manage any expectations around financial support and so on and so forth?
I think with that, it's all in the beginning and the preparation and how you go about these conversations. So we did a lot of information sessions where the social workers went, particularly connected with faith leaders, imams and church, and just started talking about fit persons, that it's voluntary from the beginning. What does that mean? And hearing people's concerns and feedback. And that's what sort of led to some types of, we found at the beginning, I'll just give you a small example, that lots of people said they were not prepared to take a baby. And when we did these conversations, it was because the cost of formula milk. And so that was something that we were able to say, okay, well, if formula milk, as in the milk, is a barrier, that's something that we can overcome. And the other thing was that financial shock at the beginning, like buying all the stuff. So again, that was how we designed this comfort kit. But I think expectation management, it starts in a conversation. And another key thing I found was connecting fit persons to why they wanted to do it. Why? Not everyone wants to be a fit person. But what we found is when we started talking about it, so many people came out with stories, about how the community had meant so much to them as a child, and they wanted to be that to a child. And so actually we found that through that initial process that most fit persons, we engaged with at least 5 or 6 different dialogues before registration. Before we even got to the point of assessing them as a family. And I think that pre-discussion and just being upfront and honest, and people could then make a choice. And I think that was key.
Brilliant. Thank you so much. And we are 16 minutes past the time of our planned end. I think we have a lot of people still in the conversation and involved, and very interested and grateful. I am personally very grateful for the time that you put in preparing, the time you put in thinking and reflecting and bringing to the fore the lessons, the challenges, and being so honest about everything you presented here. I encourage everyone participating to reach out to you all and follow up on conversations and deeper questions. I would like to really thank Railway Children for an amazing opportunity and the fantastic conference. At least this particular workshop was of great interest or presented fantastic learnings from the region. And I think it's really relevant to the global learning. And let's not forget the day of general discussion is very close. And some of these experiences will be presented there through the voice of people with lived experience or representatives of NGOs. Once more, to all those online who listened, who asked questions, and all of you presenters and leaders in care reform, thank you so very much. And I hope you will continue to be a network of support for all the organizations in Tanzania who want to change the way they care for children. Thank you.